I was at a charity softball game between the police department and the fire department, and during the softball game, somebody hit a pop fly. I ran for it, somebody else ran for it, neither one of us called it, and we collided. It knocked me out, and I had a severe concussion at the time, and was transported to Botsford Hospital. I was in ICU and really didn't know what was going on. I lost feeling in my arms, and from my elbows to my fingertips, I couldn't feel them. But if you touched me, it was excruciating pain. A lot of doctors came in explaining everything that was going on and my injuries. I really wasn't having an understanding of what was going on. I was very scared of what had happened, and worried about what was going to happen. And Dr. Kelkar, he sat down and he explained everything, and what he had to do and how he was going to do it. And he assured me that I was going to be okay.
Mr. Ivey came into the emergency department at Botsford Hospital, and he was involved in a pretty serious accident. He was paralyzed in his upper extremities and had burning pain in his arms with numbness, which is called cervical central cord syndrome, due to some traumatic disc herniations in his neck. Unfortunately, in the situation he was in, there really was no conservative treatment for this. Given the fact that he had his wedding coming up 10 days after his accident, we had quite an amount of anxiety with his fiancée and with himself. However, given the serious nature of his disc herniations pressing on his spinal cord, the most prudent thing to do would be to urgently decompress his spinal cord. The surgery that Officer Ivey had was called an anterior cervical decompression fusion. So the surgery itself, as you can see in this model, involved going from the front of the neck and removing the discs and looking directly at the spinal cord and freeing up the pressure on the spinal cord. This allowed the spinal cord to regain its function. Without it, it would have had a continued compression upon it and lead to permanent spinal cord injury. One of my primary goals is to address patient issues, see them, and do their surgery, if urgent or necessary, within a timely manner. So it relieves a lot of anxiety for family, and it relieves a lot of anxiety for the patient.
When he found out that my wedding was coming up, he moved the surgery up so that I can get out of the hospital earlier. When I woke up, I kind of did a self-check, and I kind of moved everything around, and I could still move. By the end of the day, I was moving around, I was walking, and everything healed up fine, and I had neck movement and mobility soon after the surgery.
Mr. Ivey's procedure went very well. Scott had a expected postoperative amount of pain that we typically control with pain medications. He recovered quite well. He went home, and he was able to go on to his wedding. His wedding was a couple weeks after his surgery, and he had nearly regained all of his strength. Myself and my wife were happy to be a part of their wedding. We're very happy for him and his wife.
No other doctor, I don't think, would actually go to a wedding, or it's more of a business. He's got probably has a very large caseload and everything like that, and it felt really good to see him at the wedding and at the reception, and he's actually now become a friend.
Scott and I became friends, and those are the types of relationships that we develop with our patients in our practice. It's more than just doing the surgery. It's a emotional and friendship connection that we have, and we enjoy what we do, and it gives us a rewarding feeling to go home at night and know that we dramatically changed people's lives.
Just the support that he gave, the advice that he gave, and the recommendations, everything turned out great. I would recommend the procedures. The doctors, they knew what they were. Obviously, they knew what they were doing. Their bedside manner was very good. In a short amount of time, I was back to work. I had full mobility. It was just a little bit sore, but it's been 1 year now, and I've had full recovery, and I really don't even notice that I had that. There are no existing pains or anything.
His functional capacity is back to normal. He's working back at the Redford Police Department in full capacity, and he's continuing to help other people in his life. Performing surgeries like Mr. Ivey's is rewarding to me because ultimately each week is something new, and each patient's story is something different. And every single time that we perform these procedures, we change their lives. We change our patients' lives. We change our own lives. And our ability to influence people's lives is why we do this. And it's the reason why myself and all my partners come to work every day. And it's the reason why we continue to come to work every day and engage in our patients in our clinic and our surgeries.